Hello and welcome everyone to another fantastic episode of Ask the Home Care Expert. As you can see, we're not in the normal offices. We were with District Mobile, so I apologize for a little bit of the screenshot going on there. But I'm with my great buddy Noah. He's with District Mobile Dental. He's going to talk to you a little bit about oral care for seniors. So Noah, why don't you start us off? What got you started in here, and what is District Mobile Dental? What is mobile dental services?
So we got started in wanting to care for my grandfather who had dementia, and we wanted to be able to get care to him in his home so that he no longer had to travel, leave his residence, and then come into our office and struggle to get care in the office. He and other clients like him that had aged out, so to say, in our practice, we needed a way to get to them because it was disruptive for them to come into our practice. And it wasn't successful. We would see people for an hour or 2 hours at a time and only get 1 or 2 x-rays. And the equipment was available. So we started with my grandfather and a couple other clients, and we just kind of went from there.
That's great. Now, is there a lot of different companies doing mobile dentistry, or how many different things can you bring into somebody's home? You can't bring in the entire practice. Mm-hmm. So talk to me about how a dentistry gets into somebody's home.
So there's a couple ways this can be done. One would be with a van application, and that's where a mobile dental van pulls up outside of either a community or a residence. They have a couple chairs on the van where dentists will see you in those regular chairs, and it looks much like a private practice. What we are able to do is actually come into the home and set up within the home. So we come with all the necessary equipment. Here's a portable x-ray camera.
Let's see if I can focus in here. Apologize for the screen here.
We've got a portable x-ray camera, a sensor here, digital sensor which goes into the mouth, and then the images are displayed right on the camera here so that we're able to diagnose and interpret in real time what's going on in the mouth. From that, we'll set a treatment plan for care that needs to be done, and then we'll bring in this unit which has all the necessary tools to get done fillings, crown and bridge, dentures, extractions, root canals, and things of the like. So this has the setup ready to go to perform all those procedures.
So I got a question from Abraham. Can you do dentures with the units that you have there?
Yes, we can do dentures. We've done plenty of denture cases. A lot of times in emergencies where someone's lost their denture and needs a case back, within a week or two. We come out, we'll do all the visits in the home, we do adjustments in the home, we work with a local lab, so we're able to get things back and forth from the client to the lab and then back for delivery pretty quickly. So yeah, certainly a lot of dentures there because the population 74 plus really has a lot of teeth that they've lost.
Yeah, absolutely. All right, let me see if I can get this back out here. And definitely keep the questions coming. So, now I read somewhere where there was some correlations between Alzheimer's disease and, oral care. Can you talk about any research that you're aware of?
Sure. So several universities around the country are doing research on this topic. It's obviously huge with the rise in Alzheimer's and dementia in the last several years. There's correlation right now, but not causation. So what they'll say is that if you have dementia, it's likely that you have worse oral care, likely because you can't do the things for yourself that you need on a daily basis. But what they're not saying yet is that periodontal disease or poor oral health necessarily causes dementia. The research is saying that the plaque that you have in your mouth goes through the rest of your body when you eat and then is distributed to your other organs. And so they're finding that same plaque in your brain, in your heart, and a lot of times with clients with diabetes, there's a link there as well. So again, correlation, not causation at this point.
Excellent. Thank you very much. Let's see if I move that over a little bit. Make sure I get back in the screen somehow. And when I posted this, that you were coming on today, I actually got a question from Kelly down in Charlottesville. Now, her dad has dementia, and she needs to set up an appointment for him. And she wasn't sure, he's never taken care of his teeth. And now he's in a lot of pain. One, is that a good person for mobile dentistry? And also, should she see a general practitioner or CPN or a dentist? What's kind of the good route to go for her?
So that's a really good question. To touch on the dementia aspect first, it's definitely the right client. Actually, about 75% of who we see has some form of dementia or several forms of dementia. The idea, again, designing the company after the need for my grandfather, we're trained for dementia and we're ready to see that client how and when is appropriate for them. So a certain time of day, and approaching them in a certain manner and responding to them in a certain manner so that they're not fearful of the guy in the mask.
And a big drill.
Which is so often the case. What I would say, as far as the primary care provider is talk to them and get clearance first as far as whether you can have a dental exam, x-rays, and a cleaning done. Often if you're having other radiation treatment, they recommend not to have dental x-rays, but certainly check with your primary care provider and then go about setting up the medical history and intake forms with your dentist because they'll want to know other conditions that you have. Do you have diabetes? Do you have dementia? Do you have heart conditions? Because as I mentioned earlier, all those are contributing factors to poor oral health.
That's good. Now, what are some of the biggest issues going on with seniors that you're seeing a lot or you get called in for? And you're not only going to their individual homes, but you're going to assisted livings.
Right.
Are you going into rehabs and hospitals too?
We do, yeah, on occasion. Dentistry seems to fall to the bottom of the list when you've got other health conditions going on, and that's understandable. But we do go to assisted livings, rehab centers. The need really is kind of everywhere. The main things I would say as far as why it's more important for older adults, for starters, your gums recede as you age. And this is leaving a lot of space open by the root of the tooth for cavities. That can lead to root canals, extractions, and then crown and bridge work, all of which gets pretty expensive. The second of which would be that a lot of older adults are on a series of medications, a lot of which dry out your mouth. And bacteria is then stagnant in your mouth rather than being circulated by your saliva, and that leads to a lot more cavities as well. And the final thing would be that you're not really as sensitive as you age to the things going on in your mouth. So my grandfather, we would see, and he always said, what are you looking at? Why are you trying to fix things? Not having known that he did in fact have cavities. And what we see on the x-rays, like on the computer here, he's not aware of. One, from the dementia, because he's just not attuned to what's going on. And two, because his teeth are less sensitive than they would be at a younger age. I mean, you or I might feel a cavity, right at the start, but a 72-year-old is just not going to have that same kind of response.
And you actually, and regarding staying on the same topic, you wrote a great article on our website, so please check out the article on HomeCare.com regarding Alzheimer's and mouth care that they forget, or I apologize, your sister wrote it. Mm-hmm. How tough is it for those that have dementia to remember to brush their teeth every single day? And I don't know if you can kind of expand on that a little bit too.
Yeah, so the biggest thing with oral health care and maintaining a healthy mouth is the daily care. And that's where it really gets difficult for dementia clients because they don't know the steps to take to get from putting the toothpaste on your toothbrush and to finishing, spitting the toothpaste out in the sink. What you can do is really break things down into short instructions. Give them a list, put it on the mirror in the bathroom, and that way they can try to follow along in short steps rather than this one big, put the toothpaste on the toothbrush and start brushing. And it's got to really be broken down so they can understand it in that manner. And helping them along with it if they're not able to do it themselves. There's the hand over hand technique where they're holding the brush, but then your hand goes over their hand and you kind of guide them along, with the process. And then there's also mirroring for them, which is just showing them exactly what you need to be doing so that they can copy exactly what that is.
Interesting. Now, I might not know if you have a cavity. A lot of it's, caregivers are in the homes. HomeCare.com has great caregivers that are going into the homes. Family members are taking care of their seniors. How would I know if something's wrong? Like even a simple a cracked tooth, since they don't necessarily have the sensitivity, how am I, as an adult child or as a caregiver in the home, to be able to look for something or feel something, or what's your advice on that?
So we have seen in some cases where clients are kind of grabbing at their ear or their cheek. Maybe they're showing signs of loss of weight or loss of appetite in that manner. And so you can kind of tell from a couple of those things, but we generally recommend that everyone be seen, once or twice a year at least, if not more than that. And all that depends on your current dental health and what your provider really recommends for you.
And mobile dental is no different than going to the dental office. I mean, you still take insurances and everything else?
No,
Or
it's
different?
it's different. Yeah,
Okay.
it's private pay.
So it's kind of like a mobile doctor. In
Exactly.
the other sense.
Yeah, it's a concierge service, and so we're non-participating with insurance.
Okay.
If someone has insurance, we'll help them with the filing, and then they get a reimbursement directly back to them.
Right.
But there's no Medicare or Medicaid coverage for dental services right now. That's a big problem in this country. So,
Right.
the government is working on those things, but slowly but surely.
Now, what other advice do you have for adult children and caregivers that are in the homes taking care of a loved one that might need dental health, maybe has dementia or something like that?
So a couple of things. Usually people are pretty resistant to you helping them with the oral care, which is why that mirroring technique is pretty good, because you can show them what to do, but not really be invading their personal space. If it's a convincing thing where they just don't believe in oral care, you gotta really, and that happens all the time, you gotta tell them, this is how you're getting proper nutrition. Things come in through your body, through your mouth, and you got to be able to bring those nutritious foods in for your other organs and the rest of your body. Smiling is actually really beneficial for you, whether you're forcefully doing it or not. It's making you happier. And a lot of people forget that aspect. And then, of course, there's avoiding disease, which I mentioned earlier, which is that, you don't want things contributing to diabetes or heart disease even further than they already are. And so really getting that primary care provider and all your other providers, not just the dental, but all your other providers on the same page so that everyone's really looking at your overall health rather than just one thing at a time.
That's great. No, I really appreciate that. Now, I want you to also talk about District Mobile Dental. You're located here in Gaithersburg, Maryland.
Right.
So what's the service area you cover, and what makes you a little bit different? Are there a lot of mobile dentistry companies out there? What makes you a little bit different than some of the others?
No, so it's they're few and far between. They do exist, and in our area, because our senior services are so good, they're a lot more prevalent than in some other areas of the country. You do have some area clinics that people can go to if it's a low-income situation and maybe they don't have the resources for a concierge visit. But as far as what we're able to do, we cover Virginia, Maryland, and DC. That's typically Fairfax and Loudoun County, Montgomery County, PG County, Howard County, and the District of Columbia. And that's, again, either in assisted living communities, CCRC, nursing home, private homes. Kind of what sets us apart, for one, is the private home visits. Most other providers aren't willing to go into the home and set up there just for one person, and we're able to do that. We have some dementia training from Dementia Friendly Montgomery and Travato LLC, which is a local dementia training company. We're family run, and I think that's probably the biggest factor.
Yeah.
We started this company for my grandfather. We treat our clients like they are my grandfather. And the communication with the other family members and community staff is really important to us, because it's not always the client that's involved, especially in dementia cases.
Yeah.
There's a lot of people that need to be kept in the loop, and so that's a big thing for us. And the last one I would probably say is our emergency service, which is that if you're having an emergency, we can come out anywhere from 24 to 48 hours and solve your problem. Recently we had an elderly woman. She was 92, trying to get to her grandson's wedding. She broke a tooth on a Wednesday. We were out on a Thursday, got her into a temporary. Nobody noticed while she was at the wedding. She had the time of her life, came back and got the new tooth the following week.
Wow.
And, it was just a great example of why this service is so necessary for people.
That's great. And how does someone contact you if, here in DC metro area, that they're interested in and finding out a little bit more, what's the best way for them to contact you?
So there's a couple ways. You can go to our contact page on our website, which is www.districtmobiledental.com. And you can fill out a contact form, send us an email. Our main number is 240-485-8688. You'll speak with my sister and our Director of Operations, Jacqueline. She can help you get registered. You can also follow us for news and updates on dental health. We're at District Mobile Dental on Facebook and at District Mobile Dental on Instagram. And some other resources for you if you're just looking for other tips. oralhealthamerica.org is a great location online to get some other tips. And the American Dental Association, ADA.org, also has some great tips specific to older adults so that you can really get a grip on what you need to be doing day to day and some other tips here and there as well. So
That's awesome. Thank you very much. About to kind of wrap it up here. Is there any last piece of advice or anything else you'd like to throw out there to people listening? And by the way, we will be posting this not only on our Facebook page, YouTube, Instagram, LinkedIn, everywhere else. HomeCare.com, social media participates. And we will also make sure that we have a link to District Mobile Dental and NOAA so that you can follow up throughout the week and throughout the year with questions, or remaining year next year as well, with questions for him. Any parting words?
Patience, I would say. And, a lot of these things, a lot of these visits, healthcare visits especially, require a lot of patience. It doesn't always go the way you'd like it to the first time. Some appointments need to be rescheduled, and others just don't go as well as you'd hoped. But I think if you have the patience and the right provider, that you'll have mostly successful time. So
that's great advice. Thank you so much, Noah. And thank you, everyone out there, for listening.
Thanks a lot.
Absolutely. And we'll be coming back next Friday, 1 o'clock, with another fantastic episode. Until then, feel free to leave any questions or comments for Noah or myself. We'll be happy to answer them throughout the week. Otherwise, have a great week. Happy holidays.
And don't forget to smile, guys.
They're a good piece of advice.